Thank you very much, Senator Warner, and thank you for your comments. As Senator Warner has said, our health care system is on an unsustainable path, and now is the time to fix it. Health care has not been working for our families, for workers, for businesses, and for our nation's economy. But today, we're actually going to talk about some of the good news that we know we can accomplish with health care reform. We're going to talk about what health care reform can do to help those families, those workers, to help the economy. It's our opportunity to control costs for Americans and to improve quality. And let me be clear, we can control costs and improve quality at the same time. And when we do this, we have to remember to keep patients at the center of this debate. The truth is, in so many cases, the healthcare industry can do more for less. Now, usually, I like to tell a story about what's going on with my constituents, because I think it helps us keep people at the center of this debate. But today, I really want to talk about some of the innovative health quality initiatives that are happening in New Hampshire. We all know that hospital readmissions are a costly problem in our country. We have a very exciting program going on in Manchester, the city's largest state in New Hampshire, at the Elliott Senior Health Center. They recognized what's happening with readmissions. They recognize that hospital discharges can be confusing and sometimes overwhelming for seniors, and that providing a little extra attention to help those seniors as they're transitioning out of the hospital can help keep them from being readmitted to the hospital. So they developed a program that they call the TRACE program. TRACE provides seniors with a health coach who helps patients with the tools and support to take a more active role in managing their medical care. And the support that those patients receive improves their understanding not only of their own health care, of the health care system in general, and it helps keep them out of the hospital. Senator Susan Collins and I have introduced a bill that would help do this system-wide, called the Medicare Transitional Care Act. It builds on successful programs like the one at Elliott Senior Health Center. Our legislation would improve the quality of care, it would reduce hospital readmissions, and it would lower costs. Research shows that we can save $5,000 per Medicare beneficiary if we enact this kind of a program system-wide to deal with hospital readmissions. And I'm happy that the key provisions of this idea are included in the Finance Committee bill, and it will give us an idea of how this is going to work system-wide. It's just one example of what we can do to improve the quality of care while we control costs. Now, there's another initiative that we've been working on, and I know that all of us here have been forced to wait in a crowded emergency room sometimes. Emergency room overcrowding is a problem that's become all too common. It's a symptom of what's going on in our healthcare system. Frequent users of healthcare services are a small but very costly portion of our population. They contribute to overcrowding in our emergency rooms, and they raise costs for everyone. These individuals often have multiple chronic conditions. Sometimes they have mental illness. Sometimes they're faced with issues such as poverty and homelessness. And they're among our most vulnerable but most frequent users of our emergency rooms because they have nowhere else to go. And in one study, one individual used the emergency room 115 times in 1 year. This is in Camden, New Jersey. And another patient accumulated $3.5 million in hospital charges over 5 years. These are charges that the American taxpayer paid the bill for because our healthcare system is not adequately dealing with frequent users of our emergency rooms. And the good news is we can change this. Through increased outreach and coordination, we can reduce utilization, we can save costs. Research shows that after 2 years of participation in a program that provides this kind of coordinated care for people who use emergency rooms, that usage of emergency rooms was cut by over half. This translates into significant savings for the taxpayer. And this is the kind of reform we must continue to look at if we're going to change our healthcare system and make it work for taxpayers, for businesses, for families. Mr. President, these are just a few of the examples of how health reform can benefit Americans. We can improve the quality of care available to people. We can control healthcare costs at the same time. I believe we can do this, and now is the time to pass meaningful health reform for the citizens of New Hampshire and for all Americans so we can achieve these changes in our system.